Welcome back to Buzz TV. I'm Steve Strum. This morning we have Dr. Scott Wagner from Esella. Good morning.
Good morning, Steve. How are you?
Thank you for joining us again on the show. We're talking a little bit offset about some issues that are near and dear to my family, specifically my wife, Chrissy, and TMJ.
Yes.
Tell us a little bit about what your firm does in the practical application treatment of TMJ.
Oh, Lordy, that's a big question.
And what is TMJ?
So that's a great question. Start off simple. TMJ, everyone actually has two TMJs, temporomandibular joint and temporomandibular joint. The common reference to I have TMJ is actually I have TMD, or temporomandibular joint dysfunction. TMD is probably a better line if somebody knows what they're talking about.
Okay.
But yeah, if I have TMJ, I have TMJ. I've got pain or something's not right with bite or alignment or function. It's leading to headaches and jaw pain, and you might be experiencing that.
Well, I know there's usually a couple reasons that my wife gets headaches. I would definitely be one of them, but she does have, you said TMD is the right way to say that.
Probably.
And to the point sometimes where it's audible. And so if somebody comes into your dental practice, you're a very special dentist. You're not just a dentist, not just a maxillofacial surgeon. You are a specialist of specialists. Is that a fair way to say that?
Okay. Yes, I have a lot of specialized training. To be clear, there is no FDA-approved specialty in TMJ. So if somebody says they specialize in TMJ, be wary. Yes, we treat a lot of TMJ problems, TMD. If you don't understand how to treat it or how to diagnose it, that's the starting point. A lot of dentists that aren't comfortable with it are just going to say, oh, you've got clicking and popping, you clench and grind, let's put you in a mouth guard, a bite guard. And that's kind of the end of it. If they do a filling and it creates pain and they don't really understand necessarily the source, maybe somebody's a mouth breather and that causes their, through childhood development, it causes their arches to be narrow, meaning their teeth or alignment. So if you get narrow teeth and you get a lot of wear and the high vaulted palate, and I mean there's a list of, a laundry list of things that affect a person from childhood development on. It usually starts with airway issues. So if kids are having snoring or breathing issues and they don't get their tonsils out, well then it's going to affect the development of their mouth, it's going to affect brain development, all these things. So I get exceedingly passionate about this when you start talking about it from a childhood development perspective, even though I'm not even a pediatric dentist. So, and I'm not a surgeon, to be clear, that you mentioned surgeon. I'm just a general dentist, Just a general dentist. I just have a lot of specialized training in cosmetic work and TMJ work. And it always, you know, it starts with the fundamentals. Do they have good airway? Do they have good posture? Are the arch forms in the right alignment? Does the tongue have good enough space? And all of these things, when they're out of whack, cause some kind of dysfunctional position. Whether you're going to get a lot of wear, whether the patient is going to get headaches or migraines, whether there's going to be a forward head posture, whether they sleep well at night, do they snore, is the tongue being shoved back? So if they're not sleeping well, you know, the number one torture technique by this FBI and the CIA is what? Sleep deprivation.
Yes.
So sleep deprivation is a crisis here in the U.S. So almost every one of my TMJ patients has some type of sleep breathing disorder or poor sleep quality. And so that's one of 100 things that we go through with patients to try and really, you know, I'm, if you will, inspector, some kind of, what's the funny guy from Inspector Clouseau? It's my job to find all of these things.
I was going to go with Gadget, like Inspector Gadget, because, you know, I mean, I go to the dentist, right, and you got a whole, like the producers back there, they've got a whole thing of buttons. I have no idea what they do, none, and they're pushing them right now. And you have this whole tray of stuff that is exceedingly concerning, but you guys sometimes make me feel a little better because I'm afraid of the dentist. So I have a little bit of fear. But mine is from, again, childhood imprint, right? I have a degenerative tooth, and my fondest memories of the dentist is, you know, watching my tooth smoking in your shield.
Oh, nice.
So things have come a long way in 40 some odd years. And so if people want to find out more about you, your business, your practice, you seem like a very knowledgeable person, a passionate guy about serving others. How do they connect with you?
So best way is to find us on the web, and it's ecellasmiles.com. It's E-C-C-E-L-L-A. It's an Italian word that means excellence or to excel, but ecellasmiles.com, or our phone number is 904-834-3737.
Thanks for joining us. I appreciate it always. You know, and I hope to have you on again.
Sure.
Guys, thanks for joining us on Buzz TV. If you like us, share us. Remember, live with gratitude.